This study took HER2-low patients, and HER2-low was defined either as immunohistochemistry 1 plus or 2 plus with a negative in-situ hybridization. Those before we used to call them HER2 negatives. The DB04 was really a study for the hormone positive HER2-low more than just HER2-low in general. There was a small subgroup of patients that we used to label them triple negative, but they're triple negative HER2-low. But it's mainly a study for still the hormone positives. So patient qualified to be on the study if they were labeled as endocrine refractory and have received at least 1 prior endocrine therapy and 1 to 2 prior chemotherapies before enrollment. Now, there is something that we almost forget a lot, that patients that were in the adjuvant setting, so early setting, and they received chemotherapy within the last 6 months and they had a recurrence, can qualify automatically to it by passing a lot of the earlier lines therapies.
Right.
And those were included in that study. So this is the population. Again, mainly the primary endpoint of the study was in the hormone positive subgroup of patients, and it compared to standard of care single agent chemotherapies. Some of the options that were used in 50% of the case was eribulin, 20% capecitabine. There was also about 10% the others like nab-paclitaxel or Abraxane, 10% gemcitabine, 10% paclitaxel. But the bulk was eribulin, the comparator with that arm. And that study got a standing ovation at ASCO 22. I mean, it was amazing to see. I've never seen it. I've been attending ASCO for a while. To see such a drug get a standing ovation, and that speaks to how important those results were. They really improved the outcomes. When looking at the median PFS, it was almost double. Like it went from about 5 months to 10 months with a hazard ratio of 0.5. So 50% reduction of the risk of progression or death by using a trastuzumab deruxtecan compared to treatment-efficient choice chemotherapy, which was huge. I mean, something we don't see before. And what I was really excited about is look at the response rate. I mean, response rate above 50%, whereas with chemotherapy was less than 20%. I mean, very, very, very impressive and very nice to see. And especially when you look at the OS data, where the median OS was about 2 years. I mean, that's the median. So some patient that had 50% of the patient did better than that, more than 2 years. In a group of patients that we label as endocrine refractory, that is, in my opinion, the area of most unmet need at this point in time. Because those patients, by the time they become endocrine refractory, unfortunately, their tumors are very aggressive, very heterogeneous. It's really hard to treat and manage. And a lot of patients succumb to that disease, unfortunately, at that point in time. And seeing a drug that comes to those populations with a median OS of 24 months, that was amazing to see.